I think I'm just looking forward to, being a sponge and soaking up as much information as I can. I'm super excited to get out there and treat real patients and deal with real life scenarios that we've been practicing this whole time, but not actually gotten to put into effect.
So I think no matter how many times you practice in class or practice with your peers, there's nothing that can really simulate that patient and clinician experience. The communication was the hardest thing for me to get used to, and it's still, for me, the hardest thing to work on in the clinic is I can do the clinical skills, I can use the equipment correctly, I can do everything we've practiced in class, but that communication with the patient is something that I wasn't able to really practice for.
You have no idea what the patient's going to say until they start saying it. So you kind of have to be prepared to utilize whatever knowledge you have to start narrowing things down, because a lot of things present similarly.
I've always known I've wanted to be an athletic trainer. So being at women's basketball for the full year really solidified it, in which I was able to follow athletes through their full rehabilitation process from start to finish.
I feel like it's been a wonderful experience, getting all this information from so many different minds. I feel like our faculty has so many different expertise that I've gotten a holistic knowledge of the profession. And I'm really looking forward to learning from experts in the field because they provide that different point of view.
So far, I've been able to work with 3 different supervisors in the clinic, and each of them came from very different backgrounds. The thing that I've learned the most from them is that, yes, there's a set thing that we're supposed to be doing, and a hearing evaluation consists of the set steps, but there's different ways that each clinician can put their own spin on things, and I think learning from all of them, you can kind of piece all of it together and become your own clinician.
Working with someone who is an expert in that field and knows a lot more than you, that mentorship, the specifics, the details involved in that, you're not really going to get without somebody who has delved into that as a specialist.
They want to teach students. That's a big part of, I think, West Virginia athletics, is they know that we have an athletic training program and they know that they'll have students, so they kind of prepare for how they're going to teach what they do to those students.
I'm excited to get out there and try things out, but I'm nervous as well just because I don't know what's out there, if that makes sense.
You do not need to know everything in the first interaction. You just need to know enough to get an idea of your game plan, and then you can kind of go back and review old coursework or delve into research and start to fine-tune that game plan.
One of my professors said to me on the first day of class was, now you're in graduate school, I'm gonna treat you like a mini colleague, because that's what you are now.
They really try and make you the best person that you can be as an athletic trainer, rather than just getting you to pass your certification exam, but kind of what type of athletic trainer they're putting out into the world.